Happy Saturday, scientists. Let's review. This week it's part 2 of B6, or Global Challenges, as we tackle the human health and disease as well as the general health and disease sections here. We begin with something a little bit more personal, human health. And I'm sure you won't be shocked to discover that we need to start off with some definitions. Let's begin with the concept of disease. A disease is when a part of the body is not functioning correctly. This can be anything either in physical or mental health. If something's not functioning the way that it's expected to, then it is termed to be a disease, and it hopefully can be treated. Diseases are broken down into two different categories. We have communicable diseases, which are diseases that can be passed from one organism to another. And these are caused by pathogens. We also have non-communicable diseases, which are diseases that cannot be passed. So these can be either inherited or come from lifestyle factors. A pathogen or pathology generator is the agent that causes the disease in a communicable disease. So this could be a bacterium, it could be a virus, it could be a fungus, and it could also be a protozoa. And we'll go into what those are a little bit later on. The first thing to begin to understand is the concept of bacterial replication. And this is to do with how bacteria are able to spread once they do manage to infect your body. Bacteria can usually copy themselves every 2 to 6 hours depending on the bacteria, and so the population would double. What will happen is that the bacteria will start off with its collection of DNA and plasmids. It will then copy itself and split into 2 bacteria, copying the genetic material as it goes. So then you'll end up with 2 identical copies of that bacterium, and each of those can then split into a further 2, and so on and so forth. So it is an exponential growth. Viruses, on the other hand, are a little bit different. Because viruses can't copy their own DNA, they need to use your cells to do it. It can be said that they hijack your cells in order to do this work. How this will happen is that a virus containing its genetic material will attach itself to a healthy cell in a sort of attack on that cell, and then the virus will insert its genes. Now you have that cell with the virus attached to it, and the genes from the virus pass into the cell. The cell is then told to copy the genetic material. and then new viruses can be made. So you've now got a whole bunch of copies of the virus DNA in the cell, and you can then make new viruses and the cell will then burst. So new viruses are made. You've got all the little viruses here in the cell, and the cell will then burst open, and these viruses will flow off to go and infect new cells, or they might be in a droplet that you then cough or sneeze out and they go and infect other people. There are a number of different diseases that you will need to know, and the best way to study this is to make yourself a table like this one with the type of pathogen, the type of disease, and the examples in both plants and animals, and then covering up certain sections of this table, try and recall the information that's missing. Remember to change the order that you're covering different things up, as you don't know what way the question is going to be asked. So you might want to cover up the type of pathogen and then relate the disease back to that. Or you might want to cover up the disease and be able to come up with an example of a disease for that type of pathogen. Now that you know about those diseases, we need to start to understand how our body can defend itself against them. And it will do this using its inbuilt defense mechanisms, such as your skin, which is a barrier to bacteria and other infections. And it's important to remember that this can be protected during cuts by the work of platelets. And the formation of scabs. So you may want to go back and revise that section if you're not sure of how that goes. Your stomach acid, which will denature viruses and bacteria. Possibly not all of them, but certainly most of them. In your airways, you have specialized cells which have cilia, and those were those little hairs on the surface of the cell. And that, combined with the mucus, will trap pathogens and transport them to the back of the throat where they can be swallowed. Where they're swallowed and then they go down into the stomach. And this is very similar to what happens with nose hairs. They'll trap pathogens. And with tears, they'll trap and wash away those pathogens. So you'll see that where there is a breach in your skin as a defensive barrier, you have some other form of system that can carry on and act as a backup to the skin, or where there's something coming into your body, such as food or air to breathe, that's going to be defended against by something else. So there's always some sort of defense mechanism there. However, occasionally that defense mechanism is breached. And this is where your immune system will take over. There are a number of different white blood cells that are involved in the immune response. You need to know about a couple of them. You need to know about cells called phagocytes. And what these cells do is they engulf other cells or engulf pathogens and break them down. So they will, if this was a pathogen here, then this cell would come and would surround it and take it in and destroy that pathogen. You also have T cells, which are going to do two things. They're going to remember previous infections, and they're going to control the response to a new infection. So what will happen is that the T cells will produce antibodies. And these will attack the antigens, or antibody generators, on the pathogen. So in some ways we can train our immune system by taking antigens from things that we would like to defend against and injecting them at low levels into our body, thus teaching the T cells what that is and how to produce the antibodies for it, so that if we do get infected by it, we already have that memory. And that's the process of vaccination, which is critically important to public health overall. But there are some other treatments or things that might be used. Some are for inside the body, and some are for the environment around us. Antiseptics are chemicals that will kill bacteria and viruses that are safe to use on the outside of our body. An example of this is iodine that's used in surgery. You might have seen it on a TV show or something where they have that brown colored liquid that's put on the patient before they cut in. That's there to disinfect the patient. A disinfectant will kill bacteria and viruses on surfaces. An antiviral will kill off viruses. These are usually specific to the virus. And they can be difficult to develop because of how viruses work. Antibiotics, on the other hand, will kill off bacteria. And so you will often have the exam question where they'll ask you, why wouldn't you prescribe antibiotics for the common cold? And obviously your answer is that, well, the cold is caused by a virus, and so therefore an antibiotic wouldn't do anything to help that. And in fact, it might create further problems of antibiotic resistance down the line. Antibiotic testing is also something that you might be asked for, and they're tested using zones of inhibition. What these are is that you'll take your petri dish with some bacteria on it, and you'll place on it sterile paper discs with the antibiotic or with a different dose of antibiotic. And what will happen is that around antibiotics that are effective, there will be a clear zone where bacteria cannot grow. And the larger this zone, the larger the power of the antibiotic. And so you'd use this to target the correct dose and the correct antibiotic for a different bacteria. Remember that to do this, you need to use the formula that area is equal to pi r squared, but that to calculate the r, you actually need to use the diameter of the circle, because usually these aren't perfect circles. So what you do first is you measure the diameter in two directions, and then you use the formula that the radius is equal to the diameter divided by 2. So you get an average of the diameter, then you use that to calculate the radius, and then you're off and away to the races in terms of calculating the area. But we also go through processes to develop and create new drugs in order to try and treat diseases that are being discovered, what we'll do first is we'll try and find potential compounds using computer programs or using compounds that we already know work. From that, you're going to usually do some form of animal or tissue testing. This is to find out if it is non-toxic. So at this point, we're not actually sure that the drug is any good at treating the disease, but we know that it's not going to harm the person that takes the drug. At some stage, after some testing on animals for whether or not the drug is useful against a disease, we'll begin clinical trials. And these are trials where we can test on healthy volunteers, and this is looking for side effects. And you might also look at people who are affected by the condition to see if it's actually going to treat them. So now that we know that the drug is safe and that it's effective, it can then be approved for use on different people. There are a number of different ways that this can go wrong, but one of the main ones is known as the placebo effect, where people believe that they're getting better just because they're being told that they're taking a drug or that they might have a possibility of getting better. To try and correct for this in a drug trial, we might give some of the either affected or healthy volunteers a placebo. So that would be some form of pill or injection that doesn't actually contain the active ingredient of the drug at all, just to make sure that people getting better are not getting better just because they feel like they should be, but are actually getting better due to the useful and active ingredients in the drugs. Not all diseases, however, are due to things being spread between organisms. Some are non-communicable, and some of these are caused by lifestyle factors such as smoking and the drinking of alcohol. Smoking is going to cause a number of different conditions in the body, or is linked to causing these conditions. Things such as cancer. It also increases the risk of heart disease. And it causes inflammation and buildup in the lungs. Drinking, especially in excessive amounts, is linked to things like liver disease, but also to cardiovascular disease and a number of different other conditions. Cardiovascular diseases are diseases that are affecting your heart and blood vessels. And these diseases can be caused mainly by lifestyle factors, but also they can be caused by inherited things. Things such as poor diet. This will increase the fatty deposits in the arteries. This is also known as plaque. if you have too much salt, then what will happen is you will have increased blood volume and therefore blood pressure. The same thing happens with consumption of other drugs or substances. And for example, you might see this from smoking, where the carbon monoxide increases blood pressure. There are a number of different ways that cardiovascular disease can be treated. Some of them are via drugs, and some of them are via more important or more difficult surgical interventions. In terms of the drugs, you need to know about statins. And what they're going to do is reduce blood cholesterol. You need to know about antiplatelets. And these will reduce blood clotting. You need to know about beta blockers. And what these will do is they'll reduce high blood pressure by blocking adrenaline. And you also need to know about nitrates, which are vasodilators. So they'll open up your blood vessels and that will diminish your blood pressure. In terms of the surgical interventions, you might have the use of pacemakers, which is an electrical device that is going to get your heart to beat at a steady rhythm, and the pacemaker is going to help control that rhythm. You might also have bypass surgery. And you may also have the use of a stent, which is going to prop back open your blood vessel where it was blocked. You may also have a combination of these different things depending on how severe the heart disease is. We are, however, very lucky in the fact that we live in an era where we have access to lots of rather advanced and life-saving medicines. Only 66 years ago, the first organ was transplanted from one patient to another, and now we're not only doing organ transplants regularly, but we're actually into the stage of looking at stem cells and gene therapy and how those might be used to treat conditions. So organ transplants are when one person's healthy organ is transplanted into a patient that has had an organ failure for some reason. So organs from a donor are given to a recipient that needs them. However, before that can happen, we do need to make sure that the tissues are matched. And this is because we don't want to have rejection. So we don't want the cells in your immune system to come and attack the new organ that you've just been given. And so therefore we need to make sure that you have a tissue match, and you're also going to need to take immunosuppressant drugs in order to keep the immune system from rejecting the organ. And these are drugs that you'd need to take for the rest of your life if you have had an organ transplant. We're now also looking at stem cell treatments. Remember that these are unspecialized cells or undifferentiated cells. And so you can have adult stem cells in bone marrow, or you can have embryonic stem cells. And the hope is that you can use these to grow new cells to replace those that aren't functioning, or maybe even new organs. The potential advantage here, especially if they are your cells, that your adult stem cells, is that there is less chance of rejection if your own cells are used, because your body will know that those cells are yours. However, there is growing debate on whether or not it is ethical to do stem cell treatments in this way. That debate also includes to the use of gene therapy, which is where we replace faulty genes with healthy copies. This is often done using a virus, but this creates a problem as there could be an immune response to that virus. There are also potential problems in that it might not reach every cell. This also means that you can be screened for diseases or for the likelihood of developing diseases. An example here is the breast cancer genes of BRCA1 and 2, wherein sometimes people will get themselves screened, and when they find out that they do have the gene, they decide right away to go and have that tissue removed so that there's no risk of them developing that cancer. But there is a debate around the use of these screening technologies as well. So you're likely to see that these modern advances in medicine are both a wonderful thing and something that poses some existential questions for us to answer as scientists and as citizens as we move forward and as these treatments become more and more close to reality. I hope that you've been able to find out the information that you needed in this video. As always, there's a practice worksheet in the description down below, and we're happy to take your questions in the comments. Until next week, happy sciencing.